Did you know that urinary incontinence affects more than 50% of people over 60? But what no one tells you is that it can disappear completely, even at 80 years old. Imagine regaining confidence and freedom without worrying about small accidents that interrupt your day. Today, a urologist with more than 30 years of experience shares his secret to saying goodbye to this problem forever. And best of all, it's easier than you imagine. What are these simple, natural methods? And why don't most people know about them? Stay with me, because I guarantee that what you learn today will change your life and the lives of those you love. Welcome to Health Now. I am Dr. Garcia, and on this channel we bring you real, effective, expert-endorsed advice to live a longer, healthier life. Here, you will not only find valuable information, but also the support of professionals with decades of experience. In today's video, we'll discover how to combat incontinence naturally, effectively, and without expensive medications. We'll cover daily habits, specific exercises, and dietary tips that anyone can implement, regardless of age. These solutions are not only practical, but have proven to be incredibly effective in patients of all ages. Before you continue, make sure to subscribe to our channel and turn on notifications. Also, stay until the end of the video, because the last two recommendations are the most powerful ones to eliminate incontinence. Trust me, you don't want to miss them. Are you ready to discover how to take control and transform your quality of life? Let's get started. Urinary incontinence is more common than you think, but it's rarely talked about openly. Essentially, it's the involuntary loss of urine, which can happen when you laugh, sneeze, or even during everyday activities. But why does this happen? One of the main causes is the weakening of the pelvic floor, a group of muscles and tissues that support the bladder and other organs. Over time, these muscles lose strength, especially in women who have been through pregnancy or childbirth, and in men due to prostate problems. In addition, factors such as natural aging, chronic diseases like diabetes, being overweight, and certain medications can contribute to the problem. Think of the pelvic floor as a hammock that, over time or with excess weight, begins to sag. This causes the bladder to not have proper support, leading to those little, or not so little, accidents. Have you ever sneezed and couldn't stop a leak? Or not gotten to the bathroom in time after feeling the urge? These situations, although common, shouldn't be something we accept as normal. Translated from Spanish to English. www.onlinedoctranslator.com. The most important thing is to understand that you are not alone, and that there are effective solutions. But to combat it, we must first understand its roots. In the next few minutes, we are going to explore how small changes in your daily habits can make a big difference. Don't go away, because what follows are simple and practical strategies to strengthen the pelvic floor and regain control. Let's move on. The secret to combating urinary incontinence starts with something as simple as strengthening your pelvic floor. You don't need expensive equipment or long sessions at a gym. In fact, with just a few minutes a day, you can start to regain control. Kegel exercises are the basis of this strengthening. But what are they exactly? They are voluntary contractions of the pelvic floor muscles, the same ones you use to stop the flow of urine. The key is to practice them correctly. Start by identifying the right muscles. To do this, try stopping urination while you're on the toilet, although this is only done as a test, not during regular exercise. Once you locate them, you can do the exercises at any time, while sitting, watching TV, or even lying down before bed. Start with simple sets. Contract your muscles for 5 seconds and relax for 5 seconds. Do 10 reps a day and, over time, increase the duration and number of sets. Consistency is key. Within a few weeks, you'll notice a significant difference. Another useful strategy is to incorporate these exercises into your daily routine. For example, while waiting for coffee or during a phone call. No one will notice you are doing them. Remember, the pelvic floor is like any other muscle. It takes practice and time to get stronger. And don't worry if it seems complicated at first. The important thing is to be consistent. In the next segment, we'll explore a simple habit like hydration and how it can improve your bladder health. Don't miss this essential part of transforming your life. It may sound counterintuitive, but drinking enough water is essential to controlling urinary incontinence. Many people make the mistake of reducing their fluid intake, thinking that this will prevent accidents. However, this practice can actually make the problem worse. Another useful strategy is to incorporate these exercises into your daily routine. For example, while waiting for coffee or during a phone call. No one will notice you are doing them. Remember, the pelvic floor is like any other muscle. It takes practice and time to get stronger. And don't worry if it seems complicated at first. The important thing is to be consistent. In the next segment, we'll explore a simple habit, like hydration, and how it can improve your bladder health. Don't miss this essential part of transforming your life. It may sound counterintuitive, but drinking enough water is essential to controlling urinary incontinence. Many people make the mistake of reducing their fluid intake, thinking that this will prevent accidents. However, this practice can actually make the problem worse. When you don't consume enough water, your urine becomes more concentrated, which can irritate your bladder and increase the feeling of urgency. In addition, inadequate hydration can lead to urinary tract infections, which are another common cause of loss of control. On the other hand, it is important to pay attention to the type of drinks you consume. Coffee, alcohol, and carbonated drinks are irritating to the bladder. Although they may be tempting, reducing their consumption or replacing them with healthier alternatives can make a big difference. Opt for plain water or caffeine-free infusions. Setting schedules for drinking water is also key. Try to spread your intake throughout the day in small amounts, rather than drinking large volumes at once. This will help prevent overloading your bladder at specific times. In short, proper hydration not only improves your bladder function, but it also benefits your overall health. It's a small change that, combined with pelvic floor exercises, can make a difference. In the next chapter, we'll talk about diet and how certain foods can be your allies or your enemies in bladder control. Don't miss it. What you eat has a direct impact on the health of your bladder. Some foods can irritate your bladder and increase the feeling of urgency, while others help strengthen your urinary system and improve control. Let's start with foods you should avoid or consume in moderation. Citrus fruits, such as oranges and lemons, while healthy, can irritate the bladder due to their acidity. The same goes for spicy foods, chocolate, and tomato-based products. If you've noticed that certain foods trigger incontinence episodes, consider reducing or eliminating them from your diet. On the other hand, there are foods that are great allies for your bladder. Fiber, present in foods such as oats, vegetables, and non-citrus fruits, helps prevent constipation, which can put pressure on the pelvic floor and aggravate control problems. In addition, omega-3, found in salmon, walnuts, and chia seeds, has anti-inflammatory properties that benefit your entire urinary system. It is also important to maintain a balanced diet rich in nutrients that promote tissue regeneration and muscle strengthening. For example, lean proteins and foods rich in vitamin C, such as red peppers, can be beneficial when consumed in moderation. Remember, small changes in your diet can make a big difference. Combine good nutrition with the exercises and habits we've already discussed to maximize results. In the next chapter, we will talk about specific physical exercises for seniors and how they can complement your efforts to combat incontinence. I look forward to seeing you. Physical activity not only improves your overall health, but also plays a key role in controlling urinary incontinence. You don't need to do strenuous exercises. Simple activities adapted to your level can make a big difference. Walking is one of the best options. It is a gentle, low-impact activity that is easy to incorporate into your daily routine. Dedicate at least 20–30 minutes a day to walking at a comfortable pace. This not only helps maintain a healthy weight, but also improves circulation and strengthens muscles overall. Another great option is yoga, especially poses that work the abdomen and pelvic floor. In addition to strengthening, yoga helps reduce stress, which directly benefits bladder control. Adaptive Pilates is another alternative, with exercises that focus on the core and can be done at home with little or no equipment. For those who prefer more specific exercises, consider basic movements, such as squats or gentle lifts from a chair, always respecting your limits. These exercises strengthen the muscles of the legs and pelvic floor, reducing pressure on the bladder. Incorporating these movements consistently will not only help you improve bladder control, but will also increase your energy and overall well-being. In the next chapter, we'll explore how stress and emotions can influence incontinence and what you can do to manage them. Don't miss out. Stress and emotions play a bigger role in bladder control than you might think. Have you ever felt that during times of high anxiety or nerves, the urge to go to the bathroom increases? This is no coincidence. The nervous system and the bladder are deeply connected, and when the body is under stress, that connection can become more sensitive. Chronic stress can cause the pelvic floor muscles to become constantly tense, making it difficult for them to function properly. In addition, anxiety-prone situations can intensify urinary urgency, creating a vicious cycle that affects both your physical and emotional well-being. To break this cycle, it's essential to learn how to manage stress effectively. Deep breathing is a simple and powerful technique that you can use at any time. Take a few minutes a day to inhale deeply through your nose, hold it for a few seconds, and exhale slowly through your mouth. This exercise calms the nervous system and helps relax the muscles in your body, including your bladder. Another useful tool is guided meditation. There are many apps and videos that can help you practice it, even if you are a beginner. Just a few minutes a day can significantly reduce anxiety and improve your emotional control. Finally, activities such as yoga or walking outdoors combine movement and relaxation, providing both physical and mental benefits. In the next chapter, we'll explore how body weight can affect incontinence and what simple changes you can make to reduce the pressure on your pelvic floor. Stay tuned. Body weight has a direct impact on the health of your pelvic floor and, consequently, on your bladder control. When you are overweight, excess pressure on your abdomen and pelvis affects the muscles that support your bladder, weakening them over time. This increases the likelihood of experiencing urinary incontinence. Think of your pelvic floor as a hammock that supports vital organs. If you put too much weight on that hammock, it will eventually start to sag. The good news is that even a small reduction in your weight can relieve that pressure and improve bladder function. To achieve this, you don't need to make drastic changes to your lifestyle. Start with small adjustments, such as reducing the portions in your meals, increasing the consumption of fruits and vegetables, and opting for whole foods instead of processed ones. In addition, including regular physical activity, such as daily walks or light exercises, will not only help you lose weight gradually, but will also strengthen your pelvic floor. Another practical tip is to stay hydrated with plain water, avoiding sugary or carbonated drinks that contribute to weight gain and can irritate the bladder. Remember, every step counts. By steadily and healthily reducing your weight, you will not only improve bladder control, but also your overall well-being. In the next chapter, we'll talk about the importance of consulting a specialist and additional treatment options. Don't miss it. While changes in daily habits and routines can make a big difference in managing urinary incontinence, it is essential to remember that each case is unique. Consulting a specialist, such as a urologist, is a key step in obtaining an accurate diagnosis and appropriate treatment. A urologist can help you identify the exact cause of your incontinence. This may include a weakened pelvic floor, recurring infections, prostate problems in men, or even underlying medical conditions that require specific attention. Plus, with the right guidance, you can access personalized treatments that complement your efforts at home. Options that a specialist may recommend include specialized physical therapies. These include advanced exercises guided by a physical therapist, which may be more effective for moderate to severe cases. There are also medical treatments, such as medications or less invasive procedures, designed to improve bladder and pelvic floor function. It is important to remember that seeking professional help is not a sign of weakness, but rather a wise decision that can speed up your recovery and improve your quality of life. Combining the practical tips we have discussed with the guidance of a specialist can be the key to eliminating incontinence permanently. In the next chapter, we'll explore nighttime tips that will help you avoid accidents and improve your rest. Don't miss it. Nighttime can be a challenge for those dealing with urinary incontinence issues, but with a few simple adjustments, you can minimize accidents and enjoy a restful night's sleep. One of the most effective tips is to reduce your fluid intake starting at 7 p.m. This doesn't mean getting dehydrated, but rather adjusting the times at which you drink water to prevent your bladder from getting too full during the night. Another helpful trick is to set a schedule to empty your bladder before bed. Even if you don't feel the urge, try to do it. If bedtime incontinence is a recurring problem, consider using an alarm to wake up at a specific time to visit the bathroom. Although it may feel awkward at first, this habit helps train your bladder and prevent leaks. Your sleeping position can also play a role. Sleeping on your side, rather than on your back, can reduce pressure on your bladder. Also, placing a pillow under your legs can relieve tension in your pelvis. With these small changes, you can significantly improve your sleep quality and stay in control even at night. In the next chapter, we will talk about the importance of discipline and how to maintain these habits to achieve lasting results. I look forward to seeing you. All of the tips we've explored so far have one thing in common. They require discipline. And even if the changes are small, consistency is what really makes a difference. Urinary incontinence won't disappear overnight, but with daily effort, you can make great progress. Discipline starts with incorporating these habits into your routine. Spend a few minutes a day doing Kegel exercises, consciously choose foods that benefit your bladder, and keep a regular schedule for hydrating and emptying your bladder. Remember, you don't need to do everything perfectly. The important thing is to stick with it. It's also crucial to measure your progress. Keep track of your progress. Note when you start to notice positive changes, or if a recommendation has been especially helpful to you. Not only will this help you stay motivated, but it will also allow you to adjust your efforts based on what works best. Finally, surround yourself with support. Talk to your loved ones about your commitment to these changes and, if possible, involve them in the process. A support system can make the journey easier and more bearable. Remember, every small step brings you closer to a worry-free life. The discipline you cultivate today will give you well-being and confidence tomorrow. In conclusion, we will do a final review of everything we have learned and reinforce the importance of taking action right now. Stay with me. Throughout this video, we've explored how small changes in your daily life can make a big difference in controlling urinary incontinence even at an older age. From understanding what incontinence is and its causes, to incorporating exercise, improving your diet, and reducing stress, you now have a practical guide to transforming your quality of life. We learned that strengthening the pelvic floor with Kegel exercises, adjusting our diet to include more fiber and omega-3, staying properly hydrated, and engaging in gentle physical activity are essential steps. We also talked about the importance of reducing stress, controlling weight, and establishing healthy nighttime habits to avoid accidents while we sleep. The most important thing to remember is that incontinence is not a curse. It is a problem that you can overcome with determination and the right tools. Although changes take time, every effort counts. Don't give up. With discipline and perseverance, you can regain control and live a worry-free life. If you found this video useful, I invite you to subscribe to our channel, Health Now, and turn on notifications so you don't miss out on more practical tips like these. Share this video with friends and family who can benefit from this information. Together, we can build a community that prioritizes health and wellness. Leave us a comment telling us what you thought of the video, or if you have any questions. We'd love to know if you've already started implementing any of these tips. Also, don't forget to check out our upcoming videos, where we'll continue to provide you with information to improve your life. Remember, you are not alone on this journey, and with the right support, you can overcome any challenge. Thanks for joining me today, and I'll see you in the next video.